In the tech industry, a glitch is an accepted cost of doing business. You ship a beta product, patch the bugs later, and hype the future to secure your next round of funding. Human biology, however, does not accept software patches. In November 2006, a 22-year-old Stanford dropout named Elizabeth Holmes flew to Switzerland. She pitched her startup's cutting-edge blood testing system to executives at Novartis, the European drug giant. According to Holmes, the live demonstration was a complete success, and Novartis asked for a formal project proposal. That perceived success acted as a powerful magnet. It attracted millions of dollars and immediate credibility from Silicon Valley royalty. Tech billionaires like Oracle co-founder Larry Ellison put their own money into the company, treating the venture exactly like a promising new software app. This diagram shows the grand technological vision Holmes sold them. A patient would prick their finger at home and place a single drop of blood into a cartridge the size of a credit card. The cartridge slots into a reader, which uses pumps to push the blood through tiny internal channels and into little wells coated with antibodies, completely automating the testing process. Securing elite board members and venture capital was the standard metric of success in Silicon Valley, but applying that metric to a medical device created a fatal flaw. Investors assumed the heavy financial backing meant the underlying science was sound. To understand why the machine failed, we have to look at the specific chemical process it relied on, the chemiluminescent immunoassay. This is a widely used laboratory technique that measures the concentration of a specific molecule in the blood by triggering a chemical reaction that produces a measurable light signal. This animation illustrates the immediate biological obstacle. Blood contains solid elements, like red cells and light-absorbing pigments, that interfere with the emission of that specific light signal. To get a clear reading, chemists have to separate the plasma and dilute the sample significantly with clear liquid. Because Holmes insisted on using extremely small blood samples, the machines required massive amounts of dilution just to have enough liquid to push through the internal pumps. That extreme dilution made the resulting light signal too weak to measure accurately. The company's entire marketing premise, providing highly accurate results from a single finger prick, was scientifically incompatible with the chemistry actually required to run the test. By 2009, the physical machines were constantly malfunctioning during pharmaceutical trials in Belgium. Cartridges wouldn't slot properly, or the internals would break down. Leadership actively ignored the mechanical failures, officially blaming the erratic results on weak cellular data connections. To avoid scrutiny from the FDA, the company exploited a legal gray area. They classified their physical blood readers as mere remote sample processing units. They argued the devices were essentially dumb fax machines that only beamed data back to their central lab in Palo Alto, California. They also utilized the laboratory-developed test loophole. A laboratory-developed test, or LDT, is a type of diagnostic test designed, manufactured, and used entirely within a single laboratory. By categorizing their tests as LDTs, the company argued their proprietary methods were entirely outside the FDA's regulatory jurisdiction. Inside the building, management enforced a strict stealth mode culture. They intentionally siloed departments to prevent communication. The chemists who saw the tests failing on the lab bench were strictly forbidden from interacting with the engineers building the physical machines. By wrapping the company in tech world corporate secrecy and operating in regulatory blind spots, management kept a fatally flawed medical device running without any objective outside verification. Isolated from regulatory oversight, the company escalated its marketing claims to secure more funding. They told investors they had developed roughly 300 different tests and boasted that their system could run 70 of those tests simultaneously on a single drop of blood. They also recruited powerful, non-medical figures to the board, like General James Mattis, the former head of U.S. Central Command. Mattis's presence projected an aura of unassailable authority, helping management justify heavy security details to protect their supposed intellectual property. This scatterplot illustrates the exact kind of data presented to those investors. The tightly clustered points along the diagonal line indicated that the proprietary blood readers correlated almost perfectly with traditional, highly accurate laboratory machines, but the data in those charts was entirely fabricated. Those highly accurate results were actually generated by secretly purchasing standard third-party commercial blood analyzers and passing the results off as their own. The wall of silence finally cracked when a small pathology blog started investigating technical discrepancies. The author connected with skeptical doctors and eventually the widow of the lead biochemist, Ian Gibbons. When investigative journalists began asking direct questions about whether the company was secretly running diluted blood samples through the Siemens ADVA, a massive standard commercial analyzer, management responded with aggressive legal threats. The company's legal team weaponized the concept of trade secrets to avoid answering basic scientific questions. They even compared their hidden, unverified testing methods to the secret formula for Coca-Cola. To distract the public, the company heavily publicized an FDA clearance for their proprietary herpes test. However, the herpes test was a qualitative test, meaning it only provided a simple yes or no answer. This was technically much easier to achieve and served as a smokescreen to hide their failing quantitative tests, which require highly precise numerical measurements. The aggressive litigation and PR campaigns were never designed to protect brilliant technological innovation. They were deployed as a shield to hide that the technologies simply did not work. The actual clinical lab running patient samples was in a disastrous state. It was officially directed by an absentee dermatologist with no pathology certification, plagued by severe biohazard safety violations, and operated by a deeply intimidated staff. Following surprise inspections from the FDA and the Centers for Medicare and Medicaid Services, federal regulators banned the company's proprietary tiny blood tubes, officially classifying them as uncleared medical devices. The final inspection report exposed the sheer scale of the failure. The lab's own internal data showed their proprietary machines were used for only 12 out of 250 tests on their menu. For the tests they did run, the quality control failure rates were staggering, including an 87% failure rate on testosterone tests. This floor plan shows the physical lengths the company went to maintain the cover-up in a specialized testing room called the Normandy Lab. They erected partition walls, taped over tinted windows, and installed fingerprint scanners to block the line of sight, ensuring visiting technicians wouldn't see the commercial Siemens machines doing the actual work. Announcing software that doesn't exist yet is a tolerated nuisance in Silicon Valley. It costs investors money and frustrates consumers. But applying that playbook to human biology is a direct threat to public safety. When reality finally caught up to the marketing, the company was forced to void or correct nearly 1 million blood tests given to real patients.